Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
It's a pleasure to be here, Madison.
Our topic today is the recent measles outbreak in South Florida. Dr. Raja, what is measles?
Measles is a disease that is caused by a virus called morbillivirus, and the disease is a highly contagious disease, which basically means that it can spread in the population very easily, and it causes kind of this upper respiratory disease, but it can manifest into bigger problems. And one of the hallmark symptoms of measles is the development of a rash that appears all over the body.
What other symptoms does measles have?
The usual viral symptoms, unfortunately. So it usually begins with a very high fever. There can be a cough, a runny nose, itchy eyes. And the fever, when it gets to be a high fever, we're talking the temperature can go up to 104 degrees. So that becomes a real problem.
What are the most common methods of transmission for the measles virus?
The most simple way by which the measles virus spreads is by touch. And also by cough, basically droplets. So if someone sneezes, coughs, or you're standing in close quarters and they're talking to you, any droplets that may move from one individual to another, that's the way that this virus gets transmitted from one human being to another.
Who's most vulnerable during a measles outbreak?
The most vulnerable age are children below the age of 5. And the main reason being, when they do get the virus, it can quickly move into real complications, and complications include things like pneumonia or heart conditions. So it can be really problematic for them, especially at that very young age.
What vaccinations help to prevent measles?
There are actually 2 vaccines out there, or the biggest one is referred to as the MMR vaccine, which is basically against multiple agents. So it's called the measles, mumps, and rubella vaccine. And the vaccine is actually given to children when they are, so it's given in 2 doses. So you first get it between when you're 12 and 15 months of age, and then you get this booster shot between the age of 4 and 6. So if you get this vaccine, so the 2 doses, then you're protected against this virus and this disease. Like there's 99% protection. Even if you've had just the first one, for a young child who may not be 4 yet, if they've just had the first one, even that will protect the child, and the protection rate is about 97%. So these vaccines are very good at protecting you from ever getting this agent and causing problems for you.
What are the long-term consequences to a measles outbreak on public health?
So it is a big problem because, one, it is very easily transmittable. So it's a very contagious virus. So to kind of put it into perspective, if one person has measles, they can very easily give it to 9 other people surrounding them. So that's really spreading the virus very rapidly. So from a public health perspective, it becomes kind of like a nightmarish scenario where you have a virus that's going to easily spread through the population and people are just going to get sick. If you're not vaccinated, you're likely to get complications. And you have to kind of imagine a young child getting a complication like pneumonia can be really difficult for the child. And really the extreme case scenario is these children, the really bad case scenario would be death in the child as well. So this becomes a huge public health problem, also because there are vaccines available, and if we could just get it out to everybody, everyone in the population, and if everyone is protected, then there won't be a public health issue for us to deal with.
Any last thoughts?
The last thoughts again would be to check and see, one, if you are vaccinated against it. For the most part, most of us are. And if you aren't, maybe start looking into it. Is it possible? There is an adult version that you can get, should you think about getting it. And if you are in a scenario where you are interacting with young children, maybe just be a little bit more protective. The usual, wash hands, sanitize, keep yourself clean, and that will prevent the spread of the virus.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.